That's right, back at Robinson Memorial Hospital with the Vice President of Medical Affairs, Dr. Stephen Francis. Great to see you, Doctor.
Nice to see you, Joe.
Let's just dive right in. I want to find out. We all know healthcare is changing rapidly. What are the biggest changes you foresee?
Well, there's tremendous changes going on. There's going to be huge challenges for healthcare providers. There's going to be increasing age of the population, increasing numbers of patients who need care, and people who are in not as good shape as they have been previously, which is all major concerns. The uninsured and underinsured population is also probably going to be requiring care in the near future, and so that will require us to have more resources for that.
Now, how will these changes impact Robinson Memorial physicians like yourself?
Well, it'll affect everyone. It'll certainly affect us in terms of the amount of resources and personnel we have to take care of those patients and to deal with them. There's certainly the age of nurses and physicians is getting older. There's less of them. We'll have to work more efficiently. There'll have to be more teamwork. We'll have to have more means of efficiently reaching out to patients and accomplishing, helping them in their care.
Doctor, what programs does the hospital have in place to maintain quality care?
The hospital and the medical staff have extensive functions in that regard. We have, for medical staff, we have peer review. We review medical records on patient care for all physicians, and we also have focused areas that are high risk, like surgery and intensive care. The hospital, in addition, has performance improvement committees, an infection control committee, pharmacy and therapeutics committee. The latter, for example, will review drug usage, any drugs that are used inappropriately, incorrectly, or given in error. So there's very exhaustive quality care procedures that go on at Robinson Memorial Hospital.
I understand, too, you use electronic medical records as well.
Well, we're certainly embarked on that, and it's a major project. It's basically to make things more safe, more secure, more readily available, to cut down on duplicity of records, to have full information available, and also to provide clinical decision support and information to people in terms of knowledge, which previously you don't necessarily have in a paper chart.
Right, and that does extend the care, doesn't it?
It really does.
Yeah.
It really does.
Will patients be able to review their own medical records?
Yes, they will. I mean, they certainly have the right to do that, but it'll be much more convenient. There'll be a patient portal, which is web-based, through which they can identify and look at their records. There's also an end-of-visit document summary that they'll get from the electronic medical record, which will summarize their prescriptions and other aspects of their care that were important during that visit.
Wow, doctor, that sounds like a big investment.
It's a huge investment for a hospital our size, $40 million in electronic medical record alone. And we invest in many other information systems as well.
And doctor, where do I go from here?
Well, I think you should talk to our Service Excellence Director, Tammy Lewis. One of the major changes in medicine these days, too, is to measure the satisfaction of patients and other people with the healthcare system, and that's a major priority here as elsewhere.
Tammy Lewis, Director of Service Excellence. Excellence is in your name. What does Service Excellence mean for the patients?
Our Service Excellence Department tracks and improves patient services hospital-wide. We survey our patients to learn what we're doing well and what we need to still improve on. We're actually looking at developing a patient advisory council that will bring our patients, our staff, our physician, and our family members together to share ideas on better patient-centered care. And we currently right now have a patient relations tracking system that documents patient concerns, and then we share those with hospital leadership so they can resolve those issues quickly with our patients and families.
Now you have something called patient advocates. What role do they play?
The patient advocate serves as a liaison between the patients, family members, visitors, and staff. As a patient liaison, they check in on patients to see how their stay has been. They also manage any miscommunication challenges that may happen between the patient and the caregiver, and they provide support to the families during a medical emergency.
It sounds like you love your job.
I love my job.
Well, for more information on Robinson Memorial, just log on to robinsonmemorial.org.